lost your hair. At what point did that happen in the process?
You lose your hair approximately 2 weeks after your first chemo treatment.
Now, does everybody lose their hair?
I think so. I think so. The medicine I know has changed. Like, I had 5-FU, and I know that was and Taxol all at the same time, and now they kind of divvy it up every week so you don't get such a strong dose, and they don't use the 5-FU anymore. But back then, yes, 2 weeks after the first initial chemotherapy,
you got a wig that looks exactly like your regular hair.
Yeah,
it was amazing.
Yeah,
but that was tough to get through that process of that happening.
But we made it fun.
Yeah,
we were
trying to.
Yeah, we were trying to make it fun.
As fun as you can.
Yeah.
Well, I was trying to get you to laugh as much as possible, like when I went and saw you in the hospital. And do you remember what I brought you? I brought you that National Enquirer. And I'm like, these people have real problems. They've been abducted by aliens. You're like, you just have breast cancer. They've been abducted by aliens and had experiments done on them. Look, and you're like, please go away. You're making me laugh and the drains are hurting me.
Yeah.
And your parents were looking at me like, she's insane.
Yeah. And it wasn't so much my head hair, but my facial hair.
Yeah.
Losing my eyebrows and my eyelashes and starting to look like an alien.
But like all of us said, you were like the hottest bald chick ever.
Oh, whatever.
You were.
Yeah.
You could rock the do-rag like nobody else.
Yeah.
Seriously. Now, what things do you think are a couple of important things that now that you've been down this road yourself, that anybody else who's finding themselves in that situation, what are the things that you tell that person?
The thing that I think is most important about my particular story is that I'm an educated person in healthcare, and that I was going to wait. That when I initially felt that lump, I was scared enough that I thought, oh my God, I'm just not going to tell anybody, and I think it will go away. And it doesn't go away. So for the people that remotely think, that this is truly breast cancer or a lump, I'm going to tell you, it's hard, and it doesn't move, and it doesn't hurt. So for my story, that fact is that I was going to wait, and ended up, thankfully, I couldn't wait. And the other fact was that when, they talk about early detection and breast self-exam, my tumor was actually on my third rib cage. Third rib down, straight below the nipple line. And so I think people have to explore all around their chest cavity. They can't just stay right around the breast tissue. They have to go underneath their arms, maybe even around their back a little bit, all over their chest, and just be, and then when I think back, I think, gosh, I remember being so tired. I don't know if you remember that, but I was so tired, and I kept thinking, gosh, why am I so tired? I must just be lazy, and the fatigue, and other women that I've talked to, they can remember that too. They can remember just this overwhelming sense of fatigue before, we really even thought there was anything wrong.
Teresa is a strong and passionate woman, but as she said, self-examination is the key to beating this disease. And never wait, because your health is too important.
I made it to the Katzman Breast Cancer Center and was excited to meet Katzman's Center Director and Chief Surgeon, Dr. Susan Beck. It's really comforting to know that there is a special place women can go for prevention and treatment. Plus, the Katzman Center is an all-in-one facility that can help women before, during, and after diagnosis.
Hi, Tam.
Hi, Dr.
Thanks for
Beck.
coming to the Katzman Breast Center.
Thank you, and thank you so much for having us here.
You're welcome.
Well, you have so much to share with us, and we want to hear all about everything that you're doing here that is helping women all across the state.
Well, thank you, and this is a wonderful center, and we'll go in shortly and walk you through what a patient has to go through when they come here.
And I would like to ask that as a woman, and if I were coming here for the first time, I know I would be filled with so much anxiety and concern. What do you do, and how do you handle a woman coming through those doors for the very first time?
Well, first of all, Katzman Breast Center is a very warm and loving environment. And I just want you to know that we see over 2,000 to 3,000 patients a year at this center, and the majority of them do not have breast cancer. and they may have other issues that we can help them work through. And we try our hardest to make it a non-scary but very comforting visit.
Well, that's reassuring. And I think that's important to note that all women, when told to come to the center for testing or just to see you, does not mean they have breast cancer.
That is correct.
So
we see only about 200 to 300 a year.
Great. So sometimes concerns aren't always what we make them out to be.
That is correct.
So
Should
thinking
we go in?
positive.
Yes.
Yes, let's go in.
All right. Welcome to the Katzman Breast Center.
Wow, how nice it is too.
This is our reception area.
Okay.
This is Kara.
Hi.
Hi.
And Tam. Nice
Yes.
to have you here.
Thank you.
Welcome to Katzman Breast Center.
Thank you. I'm glad to be here.
We're able to meet and greet patients as they come in here in a very warm environment.
It is warm, and I think sometimes when you're in a medical office, the environment alone creates anxiety. So to have some soothing, peaceful, beautiful decorating and colors, that's already putting me in a better feel.
And then definitely some rest in here until we're ready to receive you into the back rooms, which we can walk back
Okay.
in there now.
All right, you lead the way.
So as we come here, you can see that nice warm feeling, the curved walls. And then this would be an example of one of our exam rooms that we have. And as you can see, when you come in, certainly we'd always like to have more space, but this is certainly allows family to be present.
Sure.
This room in particular has some of the instruments that we use for special procedures, minimally invasive biopsy. So this would be our procedure room here. And we have plans for a future expansion. We would have just a few more rooms that have that availability, where we have our ultrasound, which allows us to do ultrasound-guided minimally invasive biopsies. So the consultation may not be much more than an exam and a plan of action. Sometimes it can proceed to a biopsy, but sometimes it can just be reassurance, reviewing all the tests, and letting the patient know exactly what she has. And again, the majority of time, benign diseases is what is found. As we leave the exam room, oftentimes then, if a patient was found to have a very worrisome lesion, and we had either performed a biopsy or made a plan for surgery, we would have the patient and the family come into our consultation room here.
Okay.
So they would come in and be with their family, and so they see several faces, and they have several ways to interact with the staff so that all their needs can be met.
All right. Sounds very comprehensive, that all needs are met here. Emotional, physical, as well as just overall well-being.
Well, and that's what we strive to do here, and certainly in this area we do the majority of our work in making plans and figuring out what we need to do as far as testing and treatment. As we come over here to this corner, this is where we share space with our radiology colleagues, and this is what is called a stereotactic biopsy. And this table is using, instead of ultrasound, using x-rays, radiation to evaluate the breast and to find the abnormality, and stereotactically, meaning from 3 different coordinates, being able to find and remove an abnormality within the breast. Very specific.
Okay.